And now, on a scale from well, I wouldn't know. I would need to feel it. But how bad does it like hurt? Like, who are our patients that will be using this? Like, who do we sell this to?
Okay, so the indications are mostly acne scars or any kind of scars also in on the body, except chloids. We're not treating chloid scars
What is
because um, chloid, like the scar, I'm probably saying it wrong, but this, sorry?
stretch marks?
No, no, no. Stretch marks? Yes, it's indication. Chloid scar, it's when the scar is like sorry?
Like the scars lifted up.
Yes,
Okay. Yeah.
yes.
Sense. Okay.
That's a sign of the skin not healing properly. So we
Right.
don't want to
Heard
damage the skin.
about it. Okay.
Acne scars, body scars, stretch marks,
Now,
red or white.
sorry to interrupt. What is your best pitch to sell this? Like, what is the best way to put this in an example for older people to understand without having to think about it so hard and make me repeat?
Okay, so in some point, our collagen, elastin, hyaluronic acid, in some point, it stopped renewing itself. Obviously,
Age?
hyaluronic acid,
Yeah.
hyaluronic acid, it's faster and easier. But collagen, it's every 7 years. So, like, we don't want to wait until
Yeah.
it's renewing itself.
Oh,
So that's going to help to
I mean, you
push
gotta
the
wake it.
process. Yeah, to awake it, to make it like we manipulating the skin to produce collagen right now. Like that's what we're doing. And especially when the skin is already old skin. I'm not talking about age because it can happen in the 40s, it can happen in the 60s. But when the skin is already has sagging skin and deep wrinkles, there is no other way to make the skin with more puffiness and less wrinkles and more collagen and elastin to
This will
hold
work.
it.
Yeah.
Mm-hmm.
That's what I was thinking. Okay. Yes.
Yes. So distractions treatment for skin types that needs to be renewed completely from the inside. Because what we put in from outside the epidermis, it's not enough to produce that because what we have to produce collagen, it's inside the dermis.
Yes.
So that's the only way. Of course, it's working the best with also a treatment for hydration. So
Mhm.
our protocol built the way like you prepare the patient with hydration, with anything you do in the clinic for like just to renew the skin, to make it more hydrate, glow. Then she can come to reversal treatment. Then after 10 days or 2 weeks, she come in again to a treatment for hydration. So every 2 weeks, we are doing something to the skin.
Okay.
Now it's painful. It's not that it's not painful, but we're using something to numb the skin.
Do we have any
And
5%?
yeah, that's what I'm using. We have here cosmetologists that works with doctors so they can
Or
have
you
something more
think we
strong.
could get some down here? Like,
Sorry,
you think we could get some like of the 10% down here?
I really don't know. I really, really don't know.
Oh,
You need a doctor for it.
my mom was a dermatologist growing up, and so like she was trying to tell me last night, like we could get the lidocaine, but we're not gonna get it legally, like if we do get it.
Yeah, so that's the thing. In every country and every state, it's different. So I really don't know the answer for that in Miami. Over here in Israel, you can buy it in the pharmacy 5%. So I tell the customers to buy it and to put it, and then it's not my responsibility. But I know some like doctors that they have a prescription for more, for like
I am
18%.
speaking to one of my friends. She's a medical director, and I'm trying to see if I can get her in here with us. And she'll get back to me sometime this week.
And
But
she doing injections as well. She
yes,
doing like
yep.
so fillers, injection. So
There's
that's gonna be like an
wait,
amazing synergy
yeah, and
with.
I do a lot of like I worked with the Scarlet and Morpheus 8 before I came here. That's what I was on
Okay.
every day. So that's what I'm used to, and I'm interested in this reverso. So
Okay, so definitely much more fun and easier reversal. Like the reaction of the skin is less like red, but it's still painful and it's still going to be red. And if you can prepare the patient that that's what's going to happen, it's the best because she can just lay down and you start, pulses, and it's going to be too much.
now
So you need to prepare them.
can I use red and blue light with the mask on for 15 minutes right after? Because that will help calm the redness down. And they're
Um,
less like,
yeah, there is no, yeah, you can try. The thing is that right after you need to put relaxo cream, and it's white and it's thick, and the red light, the blue light, whatever, it's not gonna penetrate anyway, the skin.
oh, all right.
So
So I have a question. I had a
yes.
2 weeks ago that I did her reverso. Everything was fine. And she had it done on a Wednesday evening. And by Friday morning, she woke up with marks all over her face. Her face was swollen. Her right eye was swollen.
That's what I'm worried about.
And
Okay.
truthfully, I believe she put something on her skin that she wasn't supposed to, because I feel if it was too high of a percentage of energy
She would have.
within
It
20,
was her first session of
yes,
reversal. So
yes.
you use 176, 30%. How
No,
much?
no, Amit doesn't want us to do that because they're not going to get enough results. And we're going right to the 88, and he wants us to try to get them as high of percentage as we can.
So what is the parameters that you use? Do you remember?
The parameters was 88 and 38%.
Which pulse?
Flat.
The double one or the flat?
The flat.
The flat. How old is she? Like,
She is she's 62, 63.
so she have wrinkles and thin skin, thick,
No, thick.
thick, normal.
Mm-hmm.
Okay. Did you do the neck as well?
Yes.
And she had only on her face the marks?
Yes.
Okay. So, and the neck, you did the same parameters as the
Yes.
face?
Yes, ma'am.
Okay. So, swallowing after 2 days, if it's also the eyes, like it's about to be closed, it's a maybe a sign for allergy. So it's either something that she put, or either she has allergy for RF needling, something inside the relaxo. Did she feel everything in her health, I don't
Yeah,
know, anamnesa that you doing before? Everything
yeah,
is good.
no,
She's
nope,
healthy.
yep, there were no indications.
So, you can't really see it coming, but I will say that for 62 years old that never done anything aggressive, to start with 88, 38% flat pulse, it's
Too
too
much.
much.
Yeah.
Too
Slowly.
much.
And we are in the protocol of not using a full tip per reverso. He only wants us to use maybe 250, maybe a little.
To 340, 250 to 340.
Well, yeah, I bypass that, but yeah. So technically, he wants us to stay within 250 to 340 pulses.
I don't think that's enough. It should be at like
For
500.
face and neck,
Yes.
how did you succeed to do it?
Yeah.
Yeah.
How can
We have, but I think it's.
And did you work like I teached you, like really, really, really like in a small gaps, like the whole skin needs to have, or did you like jump?
No, I no, we haven't been jumping. Um, do I think that I could be doing it a little bit smaller for Amber and I, because Amber and I have been using it for the past month. Yes, I do.
So what do you do with the other like 400 pulses? It's like for the second treatment?
We're putting them back in the box, and when they come back for their, next month, we're finishing the pulses.
Okay, so I have few problems with that. If you would tell me you take a client and you know for sure you're going to use 176 tip for at least the two first treatment, then maybe I will say, okay, but you don't know that. Like you doing the first treatment with 176, the
No.
reason is I know you told me 88, but that's another problem. But let's say you working by the protocol and you're working with 176 and you see the reaction is good, and now you want to jump to 88. That's the whole point to start with 176 to see how the client react to the treatment. Now you telling me you did 88 and she reacted in a certain way, and now we don't know if she doesn't fit for the treatment or it was too much for her. Because
Right.
if you would tell me that you work exactly by the protocol, 176 fast pulse, even 38% doesn't matter, but fast pulse and 176, and she would react like that, I would tell you that maybe she doesn't fit for the treatment. Maybe that's the max you can go with her specifically, but now we don't know. So one issue is that I understand, but I will speak with Phil and I will explain to him the how important it is, and from experience. It's not like, okay, we working with this for many years. We have many clients that are working with this. It's really important. Now, when you have the practical, like for few months, and you realize this is a client, like she's young, she have acne scars, she did some treatment before, maybe some peeling, maybe some destruction treatment, and you know her skin is able to heal properly, then okay, start with 88. But if she's older, okay, and she never done the structured treatment with you, I don't care what she did in other clinics because I don't know. She can tell me, but it's not gonna be like, you know. So as far as you don't know the client and it's her first treatment, never start with 88. Never. Only in the body.
What should you start with? What's a good number?
176. It's a tip.
You have 3 tips. You have 3 kinds. You have 176 needles, electrodes, that is like more spreading, so it's less painful and the reaction is less. The second one is 88 electrodes, which is medium. And then you have the 44, which is the most stronger one. It's for thick skin, for from the third treatment, maybe. You'd never do it at the first or the second. Maybe in the body you can at the second.
And 88 is for who?
So 88, it's when the patient from the first treatment react well, and now you need to go deeper. You need to go higher with the parameters. So thick skin, acne scars, even deep wrinkles. Okay, like this lady, if we would have done the 176 and she would react good, then maybe we will take the 88. But 176 give you like the idea of what's next.
All right. Well,
We need her to help us figure out the protocol for the product.
yeah,
I
Amber.
will.
Yeah, Amber just
I
reminded
hear
me
you.
they want the protocol or help us to figure out what our protocol should be for the body with La Fontaine and the Reverso, because we're getting a cryo machine, and I guess they somehow want to incorporate a whole treatment.
What? I didn't understand. Who wants to?
Met and Joe here.
Kefir and Amit.
Okay, you asking me how to combine the Reverso and the La Fontaine?
No,
No.
the
Cool sculpting.
cool sculpting.
Cool sculpting? What is it?
Right. The
Cryopolis. It's like when you freeze the fat and it freezes it and then the fat drains out through the lymphatic system. Permanently
Okay.
fat cells.
Okay, thank you. Wait, I will charge my laptop. I see there is no battery. Sorry. It's not working on the fat. Okay, it can work on the lymphatic system, the La Fontaine, because of the vibration. So we circulate in the whole blood system. So it's also helping the lymphatic system. And if you really, first of all, swallowing, like swallow face from water, it's a contraindication for La Fontaine. Okay, because it makes the skin more like with more like water, and the puffiness is like one of the things that you see right after La Fontaine treatment. So if she have like a lot of water here or maybe here, this is not the technology for that, if that's what you want to treat. But I will tell you, if you take only the vibration with the silicone tip and you stand on the lymphatic node, okay, so like here, 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 then you make it work. And then with your hands, you're doing the lymphatic drain, then you can help her. But it's not technologies that working on the fat. Let's make it clear. It's only on the dermis.
Okay, but
sorry.
It's cryo is a different machine.
Okay.
So it's a different modality that you put a handle on the body and you drain, like you go in a downward motion to where at the same time you're doing lymphatic drainage, you're also going down into the subcutaneous fat, and you're you're freezing it so it kind of shrinks, and then you pee it out or poop it out, however direct.
Okay, it's coming out from your system. Yeah.
Yeah. So what he wants to do is, as they're losing that fat, create a protocol with the Reverso for tightening,
Skin tightening.
Mm-hmm.
and I'm not really sure. I guess L'Enfontaine would come in, not necessarily with cryo, the fat reduction modality, but with
The RF magneto.
the
I will take some advices for my team, and I will get back to you with a protocol.
L'Enfontaine on the body?
It can be used on the body.
So if you were to use L'Enfontaine on the body, where and how would you do it, Io?
Okay, we're gonna speak about the La Fontaine in a minute. I just wanted to show. I want to show you. The modelist is waiting, so I'm gonna show you a reversal treatment now. You can ask me question during the treatment, and then we're gonna do the La Fontaine. Okay.
Okay. We need to.
So 1 second.
Is someone here?
No, but someone will be there because we still have to get through this, and we still have to get through L'Enfontaine on this one. And I have none. But that's okay. Go, Io. Do the Reverso.
Okay.
And,
I still got to do your treatment. I got to do your Reverso today, so I can
we'll
learn.
probably do it after work, baby.
Yeah.
Because I'm gonna know.
Yeah. Yeah. Okay. Good morning. I've been at work since 7. Thank you so much. I'm super excited. I'm glad I know.
Okay.
Yay!
So here it is. 4 times number 1 is to
Get
open
in.
the screen to log in.
Okay.
So, yeah. Okay, skin needs to be clean, of course. But also to clean it with alcohol 70%. Okay, before, only before, not after.
I'm just curious. Gonna dry the skin, no?
Mm-hmm. It's good. Our fractional likes dry skin. It's
okay.
The energy works the best.
Water, right?
Sorry?
It's going in to target the water, correct? And like shrink the skin and the pores and tighten. Okay.
Exactly.
All right, so she's showing you.
I did put something to numb her skin a little bit, so that's why I'm cleaning it more
Yes, because we do not want
aggressively.
burns.
What did she number with?
She's numbing her with lidocaine, right? Or you already did?
Yeah, I did.
5% or
what's your
5%.
And how long did you do it for?
40 minutes.
You hear that?
Why are you laughing?
I'm gonna book all my appointments for head now.
Okay, parameters. The tip is 176.
I hollered to Amber because he literally thinks we can do it for 15 minutes.
No, there is nothing.
15 minutes. And
maybe if you put nylon. How you say nylon?
Yeah, like if I did, saran wrap.
Yeah, maybe 20 minutes, maybe.
But
okay.
Yeah, so he wants to do 15 minutes, 20 minutes at the most, and try to get them to 35% or higher with an 88 tip.
No way.
No, so at least let them sit it with longer, at least that.
Yeah.
Okay, 176 tip, a fast pulse. Okay, fast pulse means that the pulse is less, it's shorter and it's less time in the skin, so it's less painful. And 30%, the energy, the amount of the energy that coming out from the tip with this pulse, it's only 30% out of 100. Okay.
So, okay. And are you getting good results at 30%?
For the first treatment, depends what your target, but for the first treatment, yes.
Our target is not the client that is sitting in front of you. Our target is
deep wrinkles.
Old people.
Deep wrinkles.
Who've never taken care of their skin.
Yeah.
Okay, so you need to start with maybe La Fontaine and then do reversal.
We've been doing nanos on those people and then upgrading them to Reverso and La Fontaine.
Also good. Okay, I sweep to start. I stretch. Okay, always have a second hand for stretching. I'm putting it and sending the pulse. Hot. Sababa?
I can't hear her beeper.
Mm-mm.
Do you hear it? No?
No, we don't hear it.
Why?
I don't know.
Okay, I want to show you the rhythm of the treatment as well. And also what's important is how close I'm working, okay?
So you don't want to overlap anything, right?
No, you do.
You do.
I do overlap a lot.
Yeah. How many passes?
For now, just one, but it seems like I'm doing more. But don't forget, it's 176. It means that like maybe one is working stronger than the other one. So that's why I'm overlapping.
Okay.
Okay.
Two passes until later in the treat. First
okay, now it's a good point for you specifically. You see the way she reacts, 1 second, is normal. It's red, it's normal, and it doesn't pain. Okay. Because you want to target deeper for the skin, I will change the pulse for double pulse. Write it down. Double pulse, it's a good pulse to start when you're working on deep wrinkles, and it's also the first treatment, but only with 176 tip, not 88 for the first treatment. And I'm checking if she's okay also with the double pulse. Okay. Perfect. She's good.
So I have one client
who
is having like no progress with Reverso and having no kind of redness, nothing. No pain, nothing. She's gotten up to like with the 88 tip, she's probably gotten up to like almost, I think like 50, almost maybe even past 50%.
How many treatments?
She would be on her third one coming up, so she just did 2, I believe. She might be on her third. Not too sure. I can't remember on the top of my head, but it's like 2 or 3 treatments.
Okay.
So
The reaction of during the treatment, she's not getting red.
she's not getting red at all.
Okay.
She says she can not even really feel it either.
Has she had plastic surgery?
Nope, no plastic surgery. This is like the first time she's ever taken care of herself.
Does she have this problem with other things? Like when she get like a heat, then she barely feel it or something like that?
Not from what I know of. Even with the nano, she was really good with it, which is, superficial.
Okay, so how old is she?
She's at least 75 on the top of.
Wow.
Yeah, she's resilient, man. She's my hard client. So I was thinking, what pattern should I do? A different pattern with her?
So the skin is thin or normal?
It's deep wrinkled and it's freckly, but I would say it's pretty tough if it, is not reacting like normal.
No, but the skin is thin or normal?
I would say
She's saying it's kind of
medium.
like tough skin, like you know how thick, scaly skin on old people, probably.
Yeah. It's pretty tough.
As long as you did 2 treatments with 88 and 50%, and the healing was good, the reaction was good, you can go to 44.
Okay. So she'll be a 44 tip next. Perfect.
Yeah, you can try.
Okay. I'll write that down.
Which is really rare for 70 plus, but
age, I was like, okay.
Good for her.
I know.
She did something good in life. To learn. She wants to settle?
Yes.
Okay. So you see 176, 30%, double pulse. It's not anymore the fast one. And she's good. Now I'm not working above the bone, so I'm stretching the skin under the bone. And then I can work on that skin as well.
So question, on the eyes, can I point the gun up like this? Like
yeah, you can work there.
Do up there and then down here you point it down and do like that?
Yes.
The eyes?
Yes, I will show you the upper eye now. So I'm stretching it up.
Cool.
I will take it down a little bit because
it's thin and
it's more painful there. So I'm taking it to 20.
Okay.
Okay. She wants and pull back. Okay, perfect. Okay, I want you to try to see the skin reaction.
Yeah, I see.
You see, it's completely red.
Right there, yep.
Mm-hmm. And if I will take it back to 30. And then
the doll, you pull back and you tuck and you staple it and tuck, correct?
Yes, always stretch. Right. Now I didn't clean the whole skin because I'm letting the cream to stay there because I'm not working there yet.
Yeah.
So I'm gonna go to the
wipe off as you work. Leave it on as long as you can and wipe off as you work.
Yeah, because why
How
not?
long does the treatment usually take?
30, maximum 40 minutes.
It takes me like 15 to do a facial with a nano and everything. So do you think this would be doable in like 15 or 30 minutes? Or
30 minutes, it's face and neck. Yeah.
If I could like numb them for like 20 minutes, I could get like 15 and do the treatment.
We do the deep cool with it, so that adds a 10 minutes if they need it. If they need
I got a question here. If they got that machine. It's called, see, now my face does not look like that when I'm doing it.
Why?
That's my question.
So let's get the answer.
Does your faces look like that?
On some people,
But not
everyone.
Energy.
I'm doing higher energy.
And then how it looks like?
The forehead looks like that for me, the cheeks look like that, and the neck looks like that. But the lips, the chin, nose area don't normally look like that.
Yeah.
The cheeks are
No, but you have to decrease the energy when you get to bones area. When you have more like bone area, you must decrease the energy.
okay.
The dermis here is really, it's thinner, and you have contra here, and then okay, with every technology, remember that. Also the forehead. That's why it's react more.
No, it's reacting less, you. Not more, less. Like we're not getting redness. We get a little splotchy.
No, but Amber said the bone area get more red. That's what she said, no?
Oh.
It looks like it gets redness. So for me, for certain clients.
Well, okay, but back to my question, because I had a client who questioned me on this. She did the reverso, and then afterwards, our protocol, we were asked to use a machine that's called D as in David, Cool. And what it does is you put water in it, and then through a hand piece, you have a flat metal piece, and it gets really cold.
Yes.
And then we take that over the skin to help with inflammation and soothe the skin.
But only because of the temperature. You're not applying any boosters or cream, right?
No.
Okay.
Amber uses Relaxo, but I think I don't.
No, Relaxo, it's fine. I'm talking about other like ingredients. Okay.
Okay, so we'll do it with Relaxo, but my client asked, and she felt that she didn't get it, she didn't see a result. And so she's like, I think you took my treatment down when you did the decool.
And how do you do the decool? With stamping?
No, you just it's a flat metal piece. You just rub it across the skin. So it's like icing the skin down.
Okay. I will answer that. Give me 1 second just to finish.
Okay.
Here, so she won't like.
Okay.
Beautiful. Okay. So about decool, by the way, it's ours as well.
I'll tell them, like, I'll tell them.
Used to be, because they don't make the decool anymore. They upgraded it to Alpha or Apollo,
yeah.
Okay, so she's right, kinda, the client. The only reason that we will use a cooling temperature after reversal is if the client feel like she cannot stand the heat and the burn, and we want to calm her nervous system down. And the way we do it is we take it and we do in stamping, and with 20 degrees, not less than that. We're not going less than that.
20 degrees.
20 is enough.
Oh, okay.
This thing goes down to a -15.
I know. No, don't do it after reversal. It's not.
I would think, okay.
The point of the reversal is to make the skin from inside hot inflammation to start to work on the skin. If we're calming it down, it's only because she tells you, what is it? It's burning. I can't stand it. You know?
That.
But when you tell her to come to the second treatment of hydration, you use the D-Cool to penetrate hydration like hyaluronic acid, peptides. I hope you're using it for that. Because electroporation, iontophoresis, it's the best technology to penetrate the hydration.
But wouldn't the cold constrict?
No, but I'm talking about
the pores.
Yeah, but when you do it after like 10 days of reversal, then that's the treatment that you want to do. And when you use minus, then you affect the skin of like to tighten the skin more, the tightening effect. You can use hot and cold. Okay, you can combine with them.
It does have hot on it. So would you use the warmth for penetration and then the cold to tighten at the end of the restoration treatment?
Yeah, both of them you will penetrate, okay, with hot and cold.
Okay.
But you use the hot first to make the blood circulation work better, and then it penetrates faster.
Okay.
And the cooling temperature is the tightening effect. Yeah.
Okay. Okay.
But don't do it at the same treatment. You can use the cool hand piece when you want to numb the skin a little bit before the reversal. You can numb it with the stamping, and then use the reversal. I can show you. I have it here, but I think you understand what I mean, right?
Yes, we do.
So we could put the stuff on the face and then just stamp it into the skin for like 10 minutes and get it all numb.
Yeah, even less. Do it area by area. For example, if I work here, I take the handpiece. I do cold temperature like this, maybe few seconds. I take the reversal and I start to do like maybe 5 up to 10 pulses. I stop. I take again the cold handpiece, doing in another area, and continue.
Okay. But it's not going to affect the temperature that we're trying to get the skin for the results we're trying to see.
Not before, but after, yes.
Okay. So, okay.
Because the heat is spreading, okay? Even now, if I'm going to work only on one area, it's going to spread to another area. So the whole point is to leave the heat.
Okay.
Yeah, I've been using D-Cool for the past few weeks. But I just didn't like that it cools it down too much.
Yeah. I might try that.
By the way, I'm already on 400 pulses.
400.
What area of the face are you on? Okay, you're only on the two. Wow.
On the other side, I did already the right side with the neck. And now I'm on the left side.
You'll probably have like 600 total?
Yeah, something like that.
Okay. So 600 pulses total.
Yeah, about average, I would say the way she's doing it, probably gonna be 600, 650. Depending on the size of the face.
I'm used to doing like 2,000 pulses.
Mm-hmm.
Charlotte, that thing was amazing. Amazing.
What else was I gonna ask?
Couple chances of following 2 reverses today to the Fontaines. Before it gets too late, I do want to talk about one client I had an issue with La Fontaine.
Okay.
So
we're changing our protocol for La Fontaine because we've got new product. But beforehand, we were using the SR cosmetics that we have here in the spa. And one of my clients ended up getting a type of like chemical burn, I would say, on her cheek after La Fontaine, on the high points of her cheeks. And as
wait 1 second, Amber. I need more information. What tip? How many passes?
blue tip, and then it was about with the high points of the cheeks exactly where she ended up, probably around 5 passes.
First treatment.
First treatment, yes.
Okay.
She has more sensitive type skin, acneic skin. But she wasn't acne, she didn't have any active acne, hence why I did the La Fontaine on her.
Do you have a picture? Do you have a picture of her?
I do. I could send you a picture.
Okay.
She's also her ethnic is she's Asian skin.
Okay. And what did you put after the
So the original protocol that Amit had us have had
There's no way.
a brightening acid peel, which
Never.
has glycolic acid in it.
Never.
what?
Never
Yeah.
put
Oh,
the skin.
So I'm kind of wondering what I should do to kind of heal the pigmentation. What would you, once she trusts me again, because now she's apprehensive about everything.
how
But
long it's been since she got the burn?
I'm sorry, what?
How long has it been since
It's
she?
about, I would say, coming up officially 3 weeks.
Okay. Did you give her something to for the inflammation and the hydration?
Yes, we gave her a serum that basically helps heal. The skin has vitamin E in it. And then that seemed to have helped the healing progress tremendously because when I saw her skin, it wasn't peeling, it wasn't scabby anymore, and it wasn't inflamed. It looks just healed like a dark scarring.
Okay, so now she have a dark spot because of it, and
Yeah.
okay. So what you're doing is only decool
Mm-hmm.
with only ingredients that hydrate. Do you use our boosters?
We just got them.
Yeah, okay. Okay, so whitening pigment, I just randomly took it, but that's what she needs.
Yeah.
Okay, and the one that you took as well.
Extra skin
Yeah.
relief
And hyaluronic acid.
and the regular hyaluronic acid.
Yeah, and you use it only on the cold temperature. And you need to do it weekly, like
Okay.
at least like
Okay.
maybe 2 times week after week. Do you have do you have a cold plasma shower?
No.
No.
Okay, so do only the decool for now. Okay, forehead, decreasing the perimeters from 30 to 20.
You hear that, Am?
I can stay on the same pose for now, and let's see. Let's see.
So you leave the forehead for last.
Yeah, but you can start with it. The only thing is really decrease the parameters in this area. So I like to finish with this because then I know how low I can get.
So you should wait for Botox or any fillers after this, right? You shouldn't do that before because it'll just dry it up.
Mhm.
It's better to do reversal, few treatment, and then fillers.
Yeah, and then
Botox, it's you can wait 1 month. It's enough. כואב לך פה. זה בסדר. עדיין בסדר?
Now, can you go on the scalp? Like, can you go a few inches back on the scalp to give it a pull and lift?
Yeah.
Not gonna kill the hair follicle?
No.
Okay. All right.
No, but it might smell really gross.
It can burn your hair. That's what I was thinking. It could burn the hair follicle because
there's smoke sometimes and it smells really nasty. So sometimes during the
I would turn the energy. You could turn the energy off for the scalp to give it a pull. Sure.
What I was gonna ask is, should we start doing planning and our restoring, because some clients really can't stand, and it would give them 2 weeks.
I have them.
Okay, and it's been working well. That's why I was wanting to ask you. You have them? Okay.
בזמן, וגם אני מספיק כאילו נגמר, פירקתי לך הכל.
Playing numbed and then done reverso because it was
לא, זה שעה קדימה, אני כל הזמן שלך מכוון אותו.
but not a lot. I mean,
Yeah,
just
I was wondering if it would be too.
I do it very light.
Yeah, the restoring.
But the restoring?
Yeah, because it's 2 weeks in between, so I figured doing a full dermaplaning would be.
Amber was asking.
Sorry, what?
Amber was asking, when they come back in after 2 weeks, are we within reason and skin would be okay and tolerate if we dermaplaned?
After 2 weeks of reversal, yeah.
Yes, okay.
Perfect.
Yeah. Okay, relaxo cream right away. So I did 650.
We need to get more dermaplaning knives for.
I need one of those stand things for the cosmetic stuff. Or not cosmetic, but the skin. Straight wrap thing.
The stuff that you have your products on that you use.
Oh, the stand. Okay, duh.
Products.
So let me continue the list because thank you for the trash can, right? You have a trash can, so you're fine. Yeah.
יכולה ללכת עם זה הביתה?
כן, בטח.
איך איזה משהו זה תספיגי?
בסדר. אם יהיה לי איצ'י, לשים את הרסטור וכאלה?
רסטור קצת ישרוף לך יום.
נשים את הקרנגולה.
שמן? לא.
זה משחה.
It's probably because.
משחה. יודעת, אולי נבדוק אם יש לי פסק קטנה להביא לך. אוקיי.
אז אני קמה.
Thank you so much. I'm just gonna give her some relaxo to put at home as well.
You can use it for the leads.
I'm gonna use it for like my tools and products and stuff.
You send me ideas on what you like and what you want, and I'll send it.
Flower.
כן.
Like what you want. I want to
for early fun.
So you're have to send me the stand that you're thinking of because I can't envision.
I'm gonna go to Ross and just.
Okay. So few things. When you use it for scars and deep wrinkles, and you see that the reaction of the skin is good, then you can do more than one pass. Okay? For example, directly on the wrinkle or on the scars, but only after you do in the whole area and you see everything is normal. She's red, nice red. Okay, the reaction is like normal. So then you can go and do another pass, even up to 3 passes.
Oh, nice. Okay.
Yes. So that gives you to use a full tip completely, especially on stretch marks as well. You will have to go a few times. And what I did with you today is for you specifically to use 176 double pulse, 30%. And if you need to decrease it a little bit on some areas or increase it a little bit in some areas. Again, it's just to make sure that she reacted well. And then at the second treatment, feel free to do 88, more energy, even super pulse, that it's the deeper one, it's the strongest one. What's that?
Super pulse, what is that?
Super pulse. Okay, so I'll show you. On the reverso, we have over here the way to change the pulses and the pattern. Do you see it?
Over here.
So no.
I'll take it closer, the phone. Like that?
Okay, yes, I see it.
Okay, how do I get there? From here.
Oh, the double, the 2.
Okay, so when we do in fast, it's the last strong one. Okay, it's for delicate skin, for clients that are sensitive, for thin skin. Maybe they have copros. Okay, so we don't want to do too much.
So that's for delicate people.
Right. Double one is already as the name, it's double. Okay, so we get in twice of the pulse. So that's what I did for the client right now. Okay, so I use this.
That's which
for
one is
anti-aging, for scars, for the first treatment, it's good.
okay. Double pulse 176, 30% energy.
Exactly. And then when you see that the reaction is good and you want to go deeper, you can use super pulse specifically on the problem. So specifically on the wrinkle, specifically on the scar. Okay, wherever you have the problem, you start with double pulse, the whole area, and then you change it to the super one and going specifically where you want to work deeper.
Okay. Okay, so that could be good on like double chins, or which is the best one for double chin?
Double chin, like
tighten up their
yeah.
call it.
Yeah, both can be good. Also super pulse, also double. Okay. And the way you work this way.
Yeah, you work up and out.
Exactly. Okay, so that was reverso. Any more questions? I think it was helpful also with the decool handpiece to make this one clear.
That's microdermabrasion, right?
La Fontaine?
Yes.
Yeah, so La Fontaine is microdermabrasion. What's special about it is that during the microdermabrasion, you're doing microvibration and red light therapy. So while you exfoliate the epidermis layer, you're also doing the microvibration and the red light therapy. That's how the handpiece built. And
plus red light therapy.
I will turn it on so you will.
And do you also do that in an up scoopward and out? Like it's rolling this way, like up?
Okay, so do you want me to put some presentation for it, or like that it's okay?
You don't have to present it if you don't. You can explain it and I can.
No, whatever easier for you to like to understand. I'm with you. Let's do it this way. I'm just gonna grab a tape. Second. Okay. So it's a really good question because it's not rolling. It's the movements are like this.
Oh, it's vibration.
Yes.
Okay. So it's pull up on the skin.
Exactly. So when we have our tip and we working with the micro exfoliation, the movements are so fast. It's 6,000 movements per a minute.
Wow.
Like incredible, fast, and a lot.
So who is that good for? Obviously, it's not going to be good for like older people with deep wrinkles. They need Reverso, right?
They do, but sometimes they can't. In the Reverso, you have more contraindications. Don't forget, you have more like people with health conditions that sometimes you cannot do. So you can do the La Fontaine. You will need more treatments, of course.
Okay.
You can do it for younger age that maybe not necessarily you want to destroy the dermis. Okay, you want to work slowly and more on the epidermis layer.
What about for those who like peels? Would they be good candidates for that? Those who like peels? It's like a chemical peel without the chemicals, right? Kind of.
Yeah, it's mechanic peel.
Yes.
If you want, look, it's working on scars and pores, open pores, and wrinkles. Of course, it's working on that. But like you said, if you can take them to Reverso, it's better. But sometimes they don't want to suffer. They have health conditions, pain. So definitely you can do it. Now in La Fontaine, we have 3 kinds of tips. We have the gray one, which is the most delicate one.
Is that delicate skin?
Exactly. Sensitive, delicate. If you want to do only for glowing protocol, not necessarily something deep, so you can use the premier. It's called the premier tip.
What is it called? What color is it?
Gray.
Gray.
The second one, premier. The second tip is blue tip. It's for normal skin. We use it for protocols that we do in the treatment every week or every 2 weeks maximum, when we want to do the transformation of the skin. And I will explain it in a minute. And then we have the purple, which is only for the body. It's very aggressive, very tight. Like the exfoliation is very rough. So it's only for the body. The idea behind transformation is the way they built the protocol every week is because we are exfoliating only the epidermis layer, and we want to make it thinner and thinner until we're going to get to the basalic layer, almost until the dermis. The microvibration and the red light therapy, okay, this is the red light therapy, and it's on the vibration as well. It's working during the whole treatment, and those are the technologies that working on the dermis.
Okay.
So imagine this is working at least 20 minutes on your face, then it's doing the work.
All right.
So every week we increasing the passes. So if the first week we did 7 passes, which passes is back and forth. So 1, 2, 3, 4, 5, 6, 7. We do not overlap it. We go in here, and we do 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. The second week, the second treatment, she's coming in 10 days, 12 days, doesn't matter. 14. 1, 2, 3, 4, 14, 21, 28, and so up to 42. If necessary, sometimes it's not necessary. On the body, we're doing 10 passes, okay, in each area. Then the second week, 20, 30, 40, up to 60. Even if she needs 10 treatments for the body, we're doing only 60. This is the maximum. It's a lot. Okay. The way it builds is when I'm putting the tip for exfoliate and to have a new exfoliation paper for each area. So when I'm done with the first area, I turn it off and I twist it. It's like a small.
Get a new piece of the thing. Okay. Yes.
And then I'm going to the second area. I finish, I twist. I finish, I twist. I finish. Okay, the whole forehead, eyes, I twist. It twists 5 times. 5 times you cover the whole exfoliation paper.
Okay.
Okay, so sometimes you will do 5 when it's like face and neck. Sometimes when it's the body and it's a small area, maybe you do, I don't know, here, then maybe you'll do only 3 times. Okay,
Yeah.
so, but it's up to 5 times to cover a whole tip, 5 areas. When we're done to exfoliate our skin, we apply in some hydration, peptides. We can use something for whitening, brightening. We can use hyaluronic acid. We can put a little bit of relaxo because the skin is working now. Imagine we also did mechanic peeling, okay, which in a completely different way, also with vibration and the red light therapy. So the skin is like, it's burning, it's working. So we put a little bit of relaxo as well, some hydration, and then we peel. I don't know why it does that. It's annoying. 1 second. Okay. So after we finish with the exfoliation, we peel the exfoliation paper, and then we have a silicone layer. The silicone layer, it's the one that we do in a massage with all the good ingredients, with all the goodies.
So pushing it into the skin.
Exactly. So if we had few rules with the exfoliation, which is separate parts, twist the tip, not overlap, counting the passes. This is the rules for the exfoliation. With the silicone tip and massaging and penetrate the creams, there are no rules.
Do it for whatever.
You do whatever, circle, you don't count. The only rule is to work minimum 10 minutes.
Okay.
In this stage. When you turn it on and you don't turn it off, it automatically will turn off after 10 minutes. So it gives you some idea how long did you work. Of course, you can put more pressure and more time on areas that you want to lift more, to penetrate more. You can work on the lips, you can work on the upper eye. Okay. Of course, the neck, décolleté, anywhere, okay? You can work with circles, okay? It's really, really nice feeling. You can just do this. You can work back and forth or like this. It really depends on how the face built, the shape of the face as well.
Sister?
Sorry?
Are you and Amit related?
No.
Oh, okay. You guys
Why? We look alike?
Yeah.
Yeah. It's just the accent, probably.
No, like you guys have like the same eyes.
Really? I never met him. I don't know. Okay, so that is the protocol. You have it written down in the presentation that I sent Kfir. So refresh yourself when you need to. We have so many nice results with La Fontaine. It's incredible. It looks like it's a toy, but it's not. It's not. It's doing a really, really wonderful job. The treatment is so comfortable and so pleasant, even, okay, compared to Reverso, let's say. And of course, but after, there are some like things that you need to let the customer know. She can be red, it can be itchy, uncomfortable. She need to avoid, again, the sun or any heat, like sauna, like cooking, and then the stove or the steams. Put relaxo for at least 1 or 2 days to calm the skin. Then she's gonna feel the skin dry because we did exfoliation and peeling, so it's gonna peel maybe. And then she will need to put a lot of hydration as well. Of course, SPF, sun cream. Contraindication is, like I said, acne, active acne, or any inflammation, puffiness, which is like not good because we're doing a lot of vibration and circulation, so it's not good for puffiness. And open brooms, of course. What else? Diabetes, when it's already on stage that, you know, every broom is like open and bleeding, so it's not something like the doctor need to give permission. But you can use it on pregnant women, you can use it on breastfeeding, you can use it for people that have heart conditions, heart issues, because it's not pulses, it's not electrical circle. So it's great. It gives you a lot of more like room to treat. And if you want to get deeper to the dermis and get results, you have to do the treatment every week up to 2 weeks. It's not like Reverso when you do it every 4 weeks. This
Reverso weeks.
Reverso every 4 weeks. 3 up to 4, depends. La Fontaine every week up to 2 weeks.
Okay.
I'm thinking anything else. You can combine them, not at the same treatment, but like I said, you can, yeah. So every 2 weeks, do another treatment. You can start with La Fontaine. If you didn't get after the 6th treatment to the result that you wanted to get, you can move to the Reverso or the other way. The other way is usually because Reverso, when you finish, it takes another 6 weeks for the dermis to build itself. So we need to wait for the result with Reverso. With La Fontaine also, but it's shorter. You can see it immediately after 6 treatment. Yeah.
Well, because the Reverso, it's not, is it microneedling or no?
No, it's not microneedling.
So what would you call it? Micro-injuring?
You can.
Hey, I'm creating a micro-injury and it's going to call your fibroblasters and your collagen. It's a rescue team that's coming to rescue your face.
Yes. And the thing is, because it's not microneedling, so you not damage the epidermis layer, the healing process is shorter because you don't have bleeding.
So deep, yeah.
Okay, so it's directly, the energies go directly from the electrodes
Tips
to
the
the
dermis.
deeper. Exactly. Okay, well, and La Fontaine is just, it takes more time because you have to, it's not going directly to the dermis, the destruction. It's just you build the dermis with the micro vibration, you build it. And the more she's aged and the more the skin is with wrinkles or the scars are deeper, then you need more treatment, of course.
So could you, or I guess I could talk to him about it, but we're gonna have to figure out a way to get these people booked 20 minutes in advance so that they can sit with numbing on and not be in pain, because we're behind, you know, we're behind and we have to do it in 15 minutes, and it's just kind of like forcing us to speed up the process instead of getting the results that we want. And I like to get results because I worked in doing Botox and all of that, and I do not want to fill these girls up with Botox. I'd rather reverse the aging process and then decide what you want.
Exactly. A beautiful way to sell also.
No, I saw reversos yesterday.
Yes.
More than that,
but definitely you need, I think, at least 45 minutes to book for a patient, and she needs to come 15 minutes before, so she needs to take 1 hour from her time.
an hour of time. We should be blocking out an hour of our time.
Yeah, you can do something else. She comes, somebody will put the numbing cream, then you finish what you're doing, and then you tell her to come.
Yeah.
And that's how we do it.
That's awesome.
Yeah, but definitely, if you can lower the pain, then why not?
I know. Nobody wants to sit through that. It is painful.
Yes, you know, this client that I just had, last time I did reverso, she didn't put, and she was okay. But I told her, like, sometimes we wake up, the weekend wasn't so good, and like we tired, we nervous, so it's affecting a lot.
Skin has feelings and memory too, and that's
exactly
because like our skin is a living organ, the largest organ.
Exactly, and also if it remembers the pain,
it does
remember it for the next time,
which is why we get wrinkles and smile lines.
It's true.
So I mean, skin has memory like our brain, and people don't realize that, and we have to poke it and wake it up. So yeah.
Okay. So I definitely talk to him about that, and also about the amount of the pulse and the tip for better results. I know he wants to get better results and he thinks to start immediately with 88, but what Angela took as example with this client, this is it. Like, you send her home, something happened, now you don't know if it's because it was too aggressive for the first treatment or because she's not fit for the treatment.
She could also be using something at home that's over the counter and probably has bad stuff in it and she doesn't know, which is a lot of these old ladies, they go to CVS and think that they're going to look pretty getting this Olay stuff, and it's got all the silicone and all these things that you don't need.
It's really, really important to make them sign before the treatment.
Yeah, consent's key. Consent is key. Yes, I agree.
Okay, so you go ahead and practice.
Okay, I'm going to
practice. And if you have any questions, I already told the girls as well, you can directly WhatsApp me and send it to me. Send me pictures of the clients before, after, whatever. We can consult and make our brain work together as well. But practice. It's the best way.
On my hand or something just to see how it feels. So I'll know how, like, what the comfortability is.
Super important. Yeah, I agree.
I think everybody should feel it.
Yeah. Yeah, definitely.
Sell something if you haven't had it. You know what I mean? It's hard to sell something if you've never done it or had it in your hands. Like I've done the scarlet on my scar right here. And like I got in a car accident and I did a scar up here. You can't even see it anymore. But the scarlet did that for me. So I believe in this. I'm excited.
Nice. I'm excited too. Good luck.
I'm gonna go get started on this, and I'll let you know if I have any questions, and we'll do before and after pictures every reversal.
Yes.
I did RX photo. I already have it on my phone, so I've had it forever because my mom, I used to work with her, and so I've got RX photo. Can I just go through my phone instead of taking the iPad, and I can chart all my notes, how many pulses I did, what is her skin like, what is her reason for being here,
Right.
like this, I did 600 pulses at 30%. I'm gonna chart all of that. So
Right. Yeah.
So everybody can know, like in case I'm not here one day and someone has to take my client, they'll know the settings and stuff.
Yeah,
So.
you have to work this way. You have to. Kfir have to work this way. It's a must. It's a beginning of the place, right? So might as well start right now. It's
Yep.
Definitely. Okay. I'm sure it's gonna be great. I'm sure.
Thank you for taking the time to show me this and walk me over everything.
No problem. Anytime. Let me know what you need. Okay.
Yes, ma'am. Thank you so much. Have a great day.
You too. Have a great day. Bye bye.